Okay, now we can start. Okay, so these and any of the card vines that we provide every month are recorded and are available in our Cardvine library. So feel free to access any of them. And if you want to listen to this presentation again, it'll be recorded in our Cardvine library at UM-NSU. umcard.org is our website. Okay, so also we're going to leave questions for the end. So just make sure you write them down so you don't forget them, and you can ask them later. All right, so hello, my name is Cecilia Alvarez Davillo, and I am I work here at CARD. I'm one of the CARD clinicians. I work in the behavior division. I'm a board certified behavior analyst, and I prepared this presentation to explain to you how we look at and analyze behavior. Because behavior really does not occur in a vacuum. There's a reason or a purpose for behavior, and that's what I want to be able to explain to you through this presentation. So today, oops, let me make sure this. So today we're going to really identify and understand the possible causes for problem behavior. We're going to identify commonly used strategies and discuss, crisis management plans for when behaviors get really out of control. Just to let you know, I'm going to talk about behaviors and functions from the point of view of how behavior analysts look and analyze behaviors and find solutions for them. We work at the Center for Autism, and the ABA has been used for really to treat any behavior, either to change an undesirable behavior or to teach a person a new behavior. And this has been used for the first, it's been used since the 20th century, like the first decade of the 20th century. It was started being used for individuals with autism, and it has remained as the standard therapy to teach and reduce problem behavior. Okay, so when we talk about individuals in the autism spectrum, we know that they have certain, difficulties. They have, communication difficulties and language difficulties. Understanding social norms are also some of their difficulties, as well as sensory sensitivities and repetitive interests and rituals. So this could contribute to some of the behaviors, but either way, we say that these behaviors serve a function, and otherwise they wouldn't do it. So when we talk about problem behaviors, we always try to explain behavior using what we say mentalistic explanations. So, behavior is the reason why people explain behavior based on their diagnosis or based on their traits. They would say, that child behaves that way because they have a behavior disorder, or because they're hyper, or because they're anxious. And so we call those hypothetical constructs. They're just saying, oh yeah, that's because of that, but there's really no observable and measurable way of explaining behavior. And so what we try and do in behavior analysis is to explain behavior giving an environmental explanation. So behavior is affected by the environment. And when we say environment, is anything that happens before and after a behavior. Any stimuli in the environment, anything that can affect that behavior. We say that it's affected by the consequences it produces, and we'll explain a little later in more detail. But basically, behavior that results in favorable consequences will be repeated. We call those reinforcement, when we reinforce behavior. On the same token, behavior that results in an aversive result, or something that's negative for that individual, tends to not be repeated or tends to be reduced, and we call that punishment. So that's like a basic explanation. So again, just to compare, when we talk about environmental variables that affect behavior, we talk about observable and measurable behaviors. So did the behavior happen when a demand was presented? So we're talking there about what happened before the behavior. Did the behavior occur when after you remove a specific task? So we're talking about the consequences there. So did the person receive attention after the behavior occurred? Or that somebody walked into the room when that behavior occurred? So, so these are very specific variables that we use to explain behavior, as opposed to, saying, oh, that person, acts like that because he's very anxious. So how do you know they're anxious? Oh, they're anxious because they act like that. And so the explanation keeps going around and around, and there's really no observable and measurable way of explaining it. So we don't use that. All right, so what is the first step? Knowing that we are going to look at environmental factors that affect behavior, the first thing we want to do is find out why the behavior is occurring. And we really don't, we do care, we do want to know what the behavior looks like, obviously. If you're measuring and looking at the behavior, you want to be able to identify it. But we really want to look at the reason why the behavior is occurring. And so we need to conduct an assessment. And so there's many different assessments, or there are specific assessments that behavior analysts use. What I will provide today is something that is more applicable for you to do at home, or if you're a professional or a teacher in the school. But hopefully it will guide you as to how to approach that behavior and how to help that person. So in behavior analysis, we explain behavior as having 4 different reasons, or purposes, or functions, we call them. We talk about escape, tangible, attention, and automatic. So it is helpful to identify the behaviors, and when we see that a behavior occurs to avoid or escape a task or an environmental context, we say, or to avoid a person, we say that the function is escape. So that person is trying to get out of something, or is trying to avoid a person or a situation. And it usually is in response to either a specific person, or an event, or a request to perform an activity, or a demand. And the reason why it keeps occurring is because when they engage in that behavior, it gets them from getting out of that situation, or avoiding a specific person, etc. So they're going to continue doing it. When we say that a behavior occurs to gain access to something, like access to food, an activity, or a toy, we say that the function, we call it tangible. And tangible often occurs when something has been denied or taken away. And of course, I have to put the iPad because that's something that every single person loves and can't live without, including myself. All right, so when we say that the behavior occurs to gain access to attention, it could be attention from a peer, or a friend, or any person in the classroom. If you're a teacher and you're observing this behavior in the classroom environment, or you're at home and you're a parent, it could be your attention or a sibling. We say that the behavior's function is attention. So the reason why the behavior occurs is to get your attention. Attention doesn't always have to be positive. Unfortunately, we provide attention when the behavior is not the correct one. So if the child engages in the problematic or a tantrum behavior, you're going to say, please be quiet, stop crying, And that is providing attention. So attention can be a reprimand, or it can be just a look, as long as a child knows that, or the individual knows that you're providing attention in one way or of another. And it often happens when a specific person is present. And the last one, when you say that behavior happens because it feels good in and of itself, we call that automatic. And automatic function is sometimes called sensory. And it just happens, it's called automatic because it automatically, when the person engages in that behavior, it automatically provides them a reinforcer. It produces its own reward. It really, when you're testing it as a behavior analyst in a functional analysis, where you're manipulating, certain environmental factors to see what really is a function, you're going to see this behavior occurring in most situations and when no one is around. There's no need for anything or anybody else to be around for this behavior to occur because it produces its own reward. So when we are talking about conducting an assessment, we're going to look at what factors in the environment are maintaining this behavior. We're talking about the function. And the way you figure it out, you start talking to people, you interview, if it's an adult, you ask them certain questions, you're going to talk to the people that know that person, and you're definitely going to observe. When you're a therapist, you may actually do some manipulation or experimentation, and we don't expect that you do that, but it sometimes happens in the natural environment, so sometimes these behaviors and functions are really easy to see. So again, we're going to observe that behavior, we're going to ask questions, we are going to make sure we pay attention to what happens before and what happens after the behavior. So the first step in conducting an assessment is definitely define the behavior. What is the behavior that you want to get rid of? But you're also going to see that you're going to also want to find a replacement behavior. And we'll talk about that in a minute. So it's not just focusing on reducing a behavior, we're also going to teach an alternative behavior. We're going to look at how often it occurs, identify the situation. So when does it occur and where? If you're a teacher in a classroom, take a look around. I know you have a lot of students in charge if you're a teacher or a therapist, but you have to make sure that you observe this individual throughout the day to see when these behaviors increase. So that's one way of identifying, doing some investigative work, right? So part of the downloads that I provided, this is one of them. We call it a scatter plot, and it sort of functions as a graph. And what you do is, parents, anybody can use this. So you have a whole week there. You don't have to use this. You can do your own. But you separate on the left side, you separate the times of the day, and you write activity to be more specific. And then you're going to be marking X's or whatever you want to track when the behavior occurs. And then the nice thing is at the end, you're going to see a trend. You're going to see that where all these X's or marks accumulate are specific. You'll be surprised to see that they accumulate during a specific time of the day, or maybe during a specific day of the week, and that sort of gives you information. Okay, this is just part of the information that you're collecting. Another step that you do after you figure out when these behaviors are happening is you're going to actually look at why it's happening. So more specifically, the function. Okay. In behavior analysis, like I mentioned before, we do a functional analysis where we set up these situations with the individual, and we sort of make behaviors happen. And I'm not going to go into details, but we create situations to see if it actually is escape or if it actually is attention. So, we provide attention constantly, and then we stop giving attention if the person starts acting in a specific way. We provide attention, and we're going to see a pattern after you do that several times. And the same thing with escape. We set up a situation where we tell the person to do something, and you know, once the person engages in that behavior, we say, okay, you don't have to do it, and we turn around. And so it just, you know, we do it several times, and we start seeing a pattern. Every time we allow that person to get out of doing a task, it gives us information as to what's maintaining that behavior. But in your case, you know, what we do is we provide you with something that looks like this. We call it an ABC checklist. And what ABC stands for is antecedent for the A, B is behavior, and C is a consequence. And most of you have heard of this before, but it is important to understand that consequences do affect the recurrence of the behavior, or a behavior from stopping, right? Either it's a reinforcement or a punishment. But we also have to look at the antecedent. So what happens before that behavior? Were there any demands given to that person? Was there no attention? Was there no access to a toy? So all of these things are also important as well. So that's why we create this chart for you to gather more information. Again, you can do your own chart. I just felt like this was an easy way and easy to use. But again, in the antecedents, you have specific there. Specifically, you have some of the conditions, you know, that are related to attention, tangibles, automatic, or escape. And then you enter whatever behavior is the one that you're measuring, and then the consequences that are related to these functions. So once you figure out the function, you have to think about treating or treatment. How are you going to reduce that behavior? How are you going to prevent? So basically, the general concept is that you're going to avoid giving that reinforcing that's maintaining that behavior after the problem, you know, behavior occurs, and you're going to give the reinforcement when appropriate behavior occurs. So just to give you a general example, if you figure out that a behavior is happening to get your attention, you're going to stop giving attention for tantrums, and you're going to give attention for what we call the positive opposites in the case of the attention-seeking behavior. So when the child asks you nicely, you're going to provide attention. When the child stops screaming, you're going to provide attention. So and you have to be very consistent and do it right away. So, and we'll go into details in the further, you know, in the upcoming slides. So you provide it, you figure out what the function is, and now you're going to treat it. So if you're trying to figure out if escape is a function, you're going to ask yourself, does the problem behavior occur when the individual, it doesn't have to be a child, anybody you can do this type of treatment with anybody. Does the behavior occur when the child is asked to do a non-preferred task, or the individual is told to do a household chore? Does the problem behavior result in you allowing that person to avoid or delay that activity or that task? Or, you know, does that problem behavior delays or buys time, or what we call that dawdling? You know, if you tell your child to clean up and then they start screaming and tantruming and questioning, you're saying, you know, that what they're doing is buying time from not doing that activity. So if you're trying to figure out if the behavior is to gain your attention, whether you're a teacher or a parent, you have to ask yourself, does the problem behavior occur when the teacher is engaged with another child or in another activity? Or when does the problem behavior occur when a parent is talking to another child or another adult, or on the phone? Does the problem behavior result in your attention? So all of these questions you have to ask yourself in order to determine. The same thing with the peers. Does the problem behavior occur in attention from peer? If you're the class clown and every time you engage in that behavior, everybody laughs in the room, then that's only reinforcing that behavior. And to the same thing with tangibles, to gain access to something. So does it occur when access to a preferred item or activity is restricted? And so if they engage in the problem behavior, do they gain access to that activity or that item? So all of these things, all of these questions are the ones that you should be asking yourself. All right, so some of the strategies that I'm going to talk about, and I provide 5 handouts at the end that you can print and use and go to as a reference in case you're not so sure. But basically, what we want you to do, we're going to talk about proactive strategies. In other words, strategies that are going to prevent some of these behaviors or minimize some of these behaviors. We're going to talk about reactive measures, or measures that are going to, you're going to basically think about what the maintaining function is, and you're going to provide reinforcement for the positive opposites in this case of attention. And we're going to talk about teaching the alternative behavior. So all of these 3 different types of strategies are going to be common in when you're treating problem behavior. So let's talk a little bit about some of the proactive measures. What can you do to prevent these behaviors? We're going to go through each one of them, but just in general, we're going to establish and maintain rules, whether it's at home, in the classroom, in the clinic. We're going to create a structure and enrich environment, and we're going to try and reduce or eliminate non-preferred tasks and environmental contexts for those sensory sensitivities. We're going to make sure that the tasks are engaging and developmentally appropriate and at the individual's instructional level. We're going to make sure that the individual understands what the expectations are. And we're going to offer choices. Sometimes choices is a good way of making sure that you're presenting the task that's required, and you're giving that individual an opportunity to choose which one they want to do. So when we talk about creating rules and procedures, you know, I use visuals, and we've learned, and at least I am very visual. We all are very, we depend a lot in visual cues. You know, we use the iPhone, or at least I use the iPhone for everything. It reminds me when I have appointments. It reminds me you know, when I have to write emails, etc. But the point is that using visual cues is very helpful. If you're a teacher in a classroom, or if you're a parent at the house, or if you're a therapist at a clinic, visual cues help the individual process the verbal information, or process language better. When you pair language with a visual cue, it helps them understand the information better. So in here you see, you know, some of the rules. You explain the rules. You say, you know, you go one by one. These are the rules in the classroom. You can you know, go over these rules every day. You can role play them to make sure that the child understands what's expected. If there is an event occurring or anything that you know, you want the individual to understand, sometimes, you know, you create these social stories, or these stories that have visual cues in them for them to understand what's expected. A lot of the times we say that these rules and the structure that you provide, especially with our individuals with autism, it helps them transition better throughout the day from one activity to another, and it reduces that anxiety that is caused by not knowing what's happening. And you know, sometimes they have difficulty processing the stimuli from the environment. So when you provide some structure, whether it is with rules and visual cues, it helps them understand and reduce that anxiety. Establishing contingencies is also very important. Again, we use visual cues to pair it with that verbal, but we all know what this is. You know, you first are going to eat the Brussels sprouts, and then you can have your ice cream dessert. or you're first going to do your homework and then you can go and play outside. So these are basically rules that need to be established so they know what's expected. You have to rehearse procedures, use visual cues if you feel like they're going to help you. You don't always have to use them, but it is helpful. Also, you use rules and visuals to clarify what is expected of them to what is not acceptable or in the classroom or at home. This is very important when you're explaining feelings and emotions. It's good that they understand what is and what is not expected, what is not accepted. And again, creating a structured and enriched environment, using a schedule to structure their day, having a routine. These are all very helpful, but you'll see that I'm going to also talk about you're not always going to have the opportunity to change the environment and make it better for them. So they also need to be able to accept certain situations, and that's part of the learning process for them and the teaching. With the sensory, I like to tell families and teachers that work with individuals in the spectrum who have sensory sensitivities is that allow them to take breaks, allow them to have their own little corner where they can calm down and relax. But you also have to teach them to come back and do whatever they need to do. So a lot of the teachers use the earphones. I've seen quiet corners in classrooms. You can do the same at home. As long as the individual has a way of calming themselves down, it is important for them to have that venue and to learn how to do it by themselves and to self-regulate whatever feelings they have. So like I said, these prevention strategies or proactive strategies are important, but you cannot just do that. You have to also teach alternative behaviors and make sure that you manipulate the functions as well. Because what's happening is that if you spend all of your life preventing certain situations, you're not teaching that individual better ways to cope. And this is important because in the end, what you're trying is to make that individual more functional and to teach them socially significant behaviors so that they can be successful person and then a functional person and as they become older and adults. And the truth is that you're not always, these preventive strategies are not always and consistently available. It depends on the circumstances. So this is why you have to teach alternative behaviors. So alternative behaviors is finding something that's easy for that person to do, and it's less effortful than the problem behavior. Remember, the problem behavior up to now has been so easy and effective for that individual, whether it's a child or an adult. It works. If they start screaming, mom's going to look at them and they're going to provide either attention or escape from whatever, or give them whatever they want. So you need to make sure and think and be very smart about finding what alternative behavior can I teach this person that is going to obtain the same results and it's socially appropriate and significant. Okay, so if your child or the individual screams to get what they want, you're gonna teach them how to ask for help. And I'm not saying this is an easy task to do. A lot of the therapists, this is what they do with most of our younger kids, is asking for help, whether it is using visual cue, what we call PECs, or using sign language, or just basically coming to you and touching your elbow, or you're touching you or grabbing your hand and taking you to whatever it is that they need. Or if the child has some words, just teach them an easy way of saying help. This is something that should always be part of your plan. I mean, these are some behaviors that you can teach it, some examples of behaviors and alternative ones. So if the child screams whenever you tell them it's time to do your homework, you're going to make sure that they do their homework, but at the same time, you're going to teach them how to ask for breaks. And so once they see that asking for breaks is effective and they actually get a break, then they'll be able to, they'll understand that, okay, I'll do a little work and then I have a way of communicating, my needs. These alternative behaviors, like I said, are not always easy to teach, but basically the trick is teaching it systematically. And what that is lots of repetition, create opportunities where you can practice it on a daily basis, and whether it's in the classroom or at home, using role-playing and rewarding and reinforcing that behavior every time they use it. So, if they sign break, you give them a break, even if it's a few seconds or a few minutes. But make sure that you reward that new behavior that you're teaching right away, and you practice that. And so alternative behaviors are important, right? Just like preventive behaviors are, teaching alternative behaviors are important, just like preventive strategies are important. But you have to make sure that alternative behavior that you're teaching is easy and effortless for that individual, and that the child, that the person who is going to honor those attempts or those alternative behaviors understand what the child's saying, and making sure that alternative behavior is more effective than the problem behavior. All right, so let's talk about strategies to reduce the problem behavior. So again, teaching the alternative behavior has to be more successful in obtaining what they want. But there's other things that you're going to do that are going to help you target that function and be smart and figure out how you can change that behavior. And so we're going to talk about active ignoring. And we use active ignoring when you figure out that the function of the behavior is its attention. We're also going to talk about not allowing escape. So basically continuing the presentation of the request or the task if the function is escape. And removing preferred items or activity temporarily is the other strategy that we're going to talk about if the function is tangible. So what is active ignoring? A lot of us do it all the time, and it can be very powerful in decreasing problem behaviors if the problem behavior is happening to get your attention. Again, this is why figuring out the function is very important. And also, you're not going to do active ignoring if the behavior is dangerous to the individual or to others around them. So obviously, I'm not condoning that. But basically, allowing the child to throw a tantrum is not letting the child get away with it. It's basically, worse if you pay attention to it. So what we want is for you to remain calm and not provide attention to that person. So making sure that safety is primary, right? So if needed, and you think the child's going to hurt themselves, you're going to block that behavior, and you're going to ignore and remain as neutral as possible. And I know this is not easy to do, and making sure safety is maintained. You're going to actually avoid looking at the child, try to kind of use body language to demonstrate that. No eye contact, don't show any anger, and continue being absorbed in some other activity. Now, remember that we also have to pay attention to whenever they do the positive opposite. So give lots of attention when the child behaves appropriately, when you perhaps tell the child, teach a child an alternative way to get your attention. That's when you have to be really quick and provide that and reinforce that. So praise, praise, praise when they do the right, when they engage in the behavior to get your attention. In behavior is an appropriate one. So what happens with active ignoring is that we call, in behavior analysis, we call active ignoring extinction. And what that means is that we're just going to stop reinforcing that bad behavior. And we're going to pretend we don't hear them or anything like that. What happens is that because it's worked so well in the past, once you start ignoring that behavior, it's going to escalate, and the child's going to really work hard, or the individual's going to really work hard at getting your attention, and they're going to amp up the volume, and they're going to be more dramatic. And what's important here is, this is very normal, and what's important is that you have to stay the course and continue your ignoring and continue your praising the right behavior. Of course, always keeping in mind that dangerous behaviors need to be attended to and are difficult to ignore. So let's talk about what is not allowing escape. So it's a way to make sure that the individual continues working, and even though he or she is misbehaving. So you want to teach them that in life you have to do what you're told. You know, whether you're a student or an employee, this is something that they need to learn. It's not always what they want, it's what society wants and what the rules are saying. So not allowing escape is very effective in teaching them a lesson and decreasing the problem behavior if that is a function. So how do you do it? You have to give very effective commands, and what that means is that you're going to provide a command that's very clear, easy to understand. If you need to move close to the child or the individual for them to understand, proximity is very important. You say their name and you maintain that eye contact, and you can use gestures to help the individual understand what it is that you are asking them to do. So simple and direct is very important. So instead of saying, clean up your toys, you can say, put your toys inside the bin, and you can use your pointing as a gesture to tell them which toys you're referring to and where you want them to put it. So very clear commands, and sometimes you need to guide them through it. So physically guiding is important because sometimes they don't know or they don't understand. So if you guide them through it, maybe the next time they'll know what it is that you are asking them to do. Sometimes again, here we have visual cues for hand washing. This is very effective, especially for younger kids. When you're telling them to do something, you do not allow access to other activities until the task is complete. You don't argue. You say the command once and have the child or individual finish it. And then once that individual does what it was requested, you provide access to a break, or you praise them for completing the task. Sometimes you do need to teach that alternative way of asking for help because they may not know it, or asking for a break. So we are going to talk about those strategies towards the end of the presentation, but always remembering to teach an alternative behavior and to praise that positive opposite. And last, what is removing access to an item or an activity? So when problem behavior occurs to get access to something that is preferred, whether it's an activity or an item, you have to remove that item or remove that child from the activity, or block access to that preferred activity. That sounds a little bit like timeout. And so what I want to say about timeout is that timeout really, the real name is timeout from reinforcement. So it only works if you're teaching the child, if the behavior is occurring to get either your attention or to get access to an activity that's really reinforcing. So in other words, in order for timeout to work, time in needs to be reinforcing. So when you remove that child from that reinforcing activity, you're letting them know, I'm removing you because when you engage in that behavior, that it's not acceptable. So this is why you're going to sit here in a corner and you're not going to have access to it. It can be very effective in reducing that problem behavior. If the behavior is to get your attention or to get access to something. Basically, when you are using timeout, you have to make sure that it's done quickly, that the child will understand, and make sure that time in is very reinforcing. Otherwise, it's not going to work. Sometimes, and I always say this in my talks when I'm talking to professionals or teachers, is that sometimes we use timeout, in the wrong way. Sometimes, a child misbehaves, let's say, in the classroom because they really don't want to be there. So they're trying to escape from being in that activity or that situation and that environmental context. So sometimes teachers take that as, oh, I'm going to send you to timeout. And what you're doing is you're reinforcing that child behavior. That's exactly what the child wants. So you have to make sure that time in is reinforcing for that individual or that child in the classroom. And then always making sure that, if there's a limited time for the timeout, you're not going to forget that the child's in timeout, because that is not effective. Once the child engages in the appropriate behavior, you've taught them how to ask for help, how to get your attention. You make sure that the child completes the task. When they're done, you allow access to that activity or you allow access to a preferred toy, etc. So always keeping in mind that for anything that you want to reduce, you have to reinforce the appropriate behavior. So all of these strategies, again, are very important. If the child has an alternative way of accessing their wants and needs, and you have to be consistent. Once you start, you have to be very consistent on implementing your strategies. So when we're thinking about reinforcing appropriate behavior, basically what we're thinking is involving, allowing the child to have a reward right after that appropriate behavior. So it increases the likelihood that that behavior is going to occur again in the future. And so in order to identify what's reinforcing for that child or for that individual, you're going to observe. You're going to see what is it that the child or the individual enjoys doing. What does he or she enjoy playing with? Or what is he or she really good at? Maybe, sometimes when we are really good at something, we basically do it all the time because we really enjoy it and we like the reaction that we get from other people. So that's what you're going to pick as a reinforcer. The trick with reinforcers is that it needs to be delivered right away, immediately after the appropriate behavior occurs. That is key, because if it's delayed, then the child's not going to, or the individual's not going to make that association. Oh, I'm getting this reward because of this behavior that I did. So you cannot delay that reinforcer. And, and you have to do it as often as possible. So again, the bigger picture when you're implementing a behavioral plan is to use those proactive strategies. So improve the environment where that individual is, so that that individual is less motivated to engage in those behaviors. So those are the preventive strategies. Foster better communication and coping skills by teaching alternative behaviors. as opposed to allowing them to engage in that problem behavior. And then, remove any positive consequence. Even, I mean, we have to really be careful here because we all do it. We pay attention to the problem behavior as opposed to paying attention to when the child's really not doing anything bad. They're sitting quietly and doing what they're supposed to be doing. And we sometimes forget to pay attention to those and praise those. So remove any positive consequence that may, follow problem behavior, and be on the lookout for the positive ones. All right, so these are the handouts that I mentioned that could be helpful. I created these thinking about teachers specifically because I go to schools and they're like, I need to have a go-to place that I can find ideas on how to cope with specific behaviors. And so I tell them and explain to them and train them about how to figure out the functions. And then once they know it, these handouts are very helpful in looking for strategies. So again, the first one is if the behavior, once you figure out that the behavior is maintained by providing attention, you're going to actively ignore. So do not provide attention. This is what we call extinction. So you're going to see that there's a common theme here. So the first one is going to be do not provide attention. The second one is going to be teaching an alternative way to request your attention. The third one is going to be provide attention for the appropriate behavior, right? The one that you're going to teach them, or the one that once they stop engaging in that problem behavior, you're going to pay attention to, oh, I like it that you're so quiet. I like it how you're sitting down nicely and quietly. Whatever it is that they're doing at that time. And then you're also going to provide attention often during the day. So this is non-contingent reinforcement. So this serves as a preventive measure. So if you're constantly providing attention to that individual is going to be less motivated to engage in that problem behavior to get your attention. So it's kind of a way of manipulating those, what we call antecedents, what happens before the behavior. So it's more of a preventive strategy. So if the behavior is maintained by tangibles or allowing access to a toy or an activity, again, you're going to not allow access to that toy or activity. You're going to teach an alternative way to request that item or activity. And you're going to provide access to that toy for the appropriate behavior and also allow regularly schedule access to that toy or activity, because it's going to make that child less motivated to engage in the problem behavior. They're like already having this, they're having access to it, so there's no need for me to engage in that problem behavior if I already played with the iPad or went to the playground. The same thing with escape. With escape, you're going to find that there's more. I have 2 handouts all the way to, there's 9 strategies or solutions that you can use, because there's a lot of things that you can do specifically in a classroom or even at home. The first few are the common ones, the common theme of not allowing escape, teaching an alternative way to ask for a break, provide access for a break, and allow regularly scheduled breaks. But then on the second page, you're going to see, some other strategies, because there are times when you have individuals that really have difficulty with, certain tasks. It could be, if it's writing, their fine motor skills may not be that developed, and they may need assistance. So do provide assistance. You have to accommodate their needs. Sometimes alternating the times when the demand is delivered, be smart about when you ask the child to do something. Use that contingency of first, then to have them do something, and that way they know that a reward will come right after. Provide choices. That way the individual has the opportunity to choose which one they want to do first. And demand fading basically is to guide them, provide physical assistance and then remove it gradually as you see that they learn how to initiate that behavior or that task if they don't know how to do it. So that is used when you're teaching a new behavior. So if they don't know how to do something, you're going to provide manual guidance, but then as you see fit and you see that they can do it, you remove that guidance and you fade it out. And with automatic reinforcement, this is really the trickiest one, because there's really it's something that is the individual is engaging in a behavior that provides its own reinforcement. So if the behavior interferes with schoolwork or is dangerous to that individual, you're going to try and look for precursor behaviors. Sometimes there's ways to know when a child is getting anxious and it's going to start behaving in a specific way and engage in that repetitive behavior. You can redirect that by taking the child to a preferred activity or keeping them busy. But you're also going to allow that individual to have access to stimuli that can compete with that response. So if you know that that individual likes to walk a lot or likes to swing, after they do their work, you allow the child to have access to swinging or some sort of movement activity. Again, accommodations are important. And then, like I mentioned, providing access to a quiet area for them to calm down is also a way to allow them to get that automatic reinforcement. But obviously, keeping in mind that you're not letting that individual engage in that behavior, throughout the day, and making sure that it's not dangerous behavior. But what happens when some behaviors are really difficult to change or to get rid of or reduce? That's when if you're a teacher, you need to communicate with parents. If you're a parent, you have to communicate with therapists, with teachers, and even with medical doctors. You always have to rule out any medical conditions. If the individual is engaging in a behavior and let's say that they have no other way of communicating with you how they feel, it's always very important to rule out any medical condition. Are they sleeping well? Are they allergic to something? Maybe they have stomach, the food's not sitting well in their stomach, so something to consider. So it is important when you feel like you cannot find a solution. So again, communicate with the parents if you're a professional. If you're registered with us, always call your card clinician. We're a good resource to find help for you and refer you to the appropriate professional. If you don't have a therapist, find a behavior therapist. You can access who's certified or not, and this is very important. You have to make sure that individual, that therapist, is certified by the Behavior Analyst Certification Board. There's a website in the slides where you can see a list. You can actually do it by state, and it provides email and phone number. I think an email for you to communicate with them, or your card clinician can refer you to the appropriate place. Maybe you have an insurance and you need to find a place that accepts your insurance. So with that, I am done with the presentation. I also want to invite you to join us to the CARD conference that's going to be in Orlando, January 29th through the 31st. You're going to find a lot of professionals in the field. You're going to meet new people and hear about new research going on about behavior, etc. So right now, I'm going to stop the recording and allow any questions. If anybody has any questions, this is the time.